Hi, my name is Haley Martin. This is my disease presentation for microbiology, and I chose to do mine over influenza, which is an infection of the nose, throat, and lungs. So a quick overview on influenza is that it is also known as the flu, which I'm sure many of you have heard of before, and probably many of you have had it before. This is a highly contagious viral infection that affects the respiratory tract. It causes seasonal outbreaks, and the seasons are usually the fall and winter, and this happens every year and sometimes even causes pandemics. There are millions of people affected annually and worldwide by influenza. So to start, we have the structure of the influenza virus. Influenza viruses are spherical enveloped particles containing a segmented single-stranded negative sense RNA genome, also known as the ssRNA negative for short. The virus is surrounded by little protein spikes, which you can see right here, the spikes surrounding it, and that would be the HA protein or the NA protein. The HA protein is responsible for binding the virus to the cell to be infected, whereas the NA protein is the release and the spread of newly formed viruses. Then we have our types of influenza. So our three most commonly known types are influenza A, influenza B, and influenza C. Influenza A is our most severe. That infects both humans and animals. And then we have influenza B. That is mild, and that only infects humans. And then we have influenza C, which is our least common. It's mild, and that also infects both humans and animals. We also have an influenza D. We don't hear of that one as much. That's said to only infect cattle, so it's not as important, but it's still a good to know. And these types of influenzas are separated in these categories by their severity, their host range, and their potential to cause epidemics or pandemics. Then we have our mutation and our evolution. So the flu virus is always changing, which is why it's always spreading. And we have two things called the antigenetic drift and the antigenetic shift. So these two things are honestly what keeps the virus going, and it's going to make it hard to get rid of completely. So to start, there are small yearly changes called antigenetic drifts, and these changes happen every year and make new flu strains. And that's why every year at the end of flu season, the flu vaccines are always evolving and always changing because of these new mutations from these new flu strains. And then there are the bigger changes that we call antigenetic shifts, and these can create completely new flu viruses, and these are what causes our pandemics. So likely how this happens is more than one influenza virus. So for example, influenza A and influenza B infect a cell, and that creates these new flu viruses because multiple influenzas are infecting one cell. So all of this leads to evasion of the immune detection system through rapid evolution. So we have our pathophysiology. Our virus infects the epithelial cells of respiratory tract, and then that causes cell death, inflammation, and immune response. So the symptoms of that are going to be our fever, cough, sore throat, body aches, and fatigue. That's not to say you couldn't have more symptoms or less symptoms. This is just what we hear of more times than not. And then these may lead to more complications such as pneumonia, croup, bronchitis, and we see this especially in our more vulnerable populations. So that leads us to our at-risk populations. We have our elderly, our infants, our immunosuppressed individuals, and our lower socioeconomic communities. So our elderly, they probably have pretty broken immune systems. Our infants, they probably don't even have a built immune system yet. Our immunosuppressed individuals, these are individuals that already have a sickness and they just can't fight off these viruses. And then our lower socioeconomic communities, these are going to be our people who don't have a lot of access or money to be able to get the health care that they need. And that leads us to our community impact. So we have increased hospitalizations, we have work and school absences, and we have economic burden, which is just the time lost at work from being sick or the money spent from being sick, just all the burdens you can have from being sick. So that brings us to our treatments. You're usually treated with an antiviral medication if your severity of flu is bad. You'd probably be medicated with something like Tamiflu or Influenza. Those must be taken within 48 hours of your symptoms, and that will help to reduce the severity and the time of your symptoms. This is a map I included of the United States. This shows 2024-2025 influenza season ending in February 8th of 2025. The red and the purples, those are very high activity levels, so you can see that it was pretty crazy this last season, which is why we need prevention. Vaccines are going to be our most effective methods. Those get updated annually to match the circulating strains, which I had mentioned earlier. The types include injection and nasal sprays. And then we have our additional prevention, which is our hand hygiene, so washing your hands, respiratory etiquette, that's covering your nose and mouth. It is said that that is how we spread it, is through the droplets of sneezes and coughs. So covering your mouth is important, and then public awareness is just spreading the etiquette to all those who may not understand or know yet. So that is very important. And that's all. Thank you, guys.